Good day, ma'am. Today I'm going to discuss the difference between the artificial methods and the natural methods. Artificial methods. Here are the sample of artificial methods. So, what is a artificial method? Common use include preventing the sperm from reaching the ovum using condoms, diaphragm, and etc. Inhibiting ovulation using oral contraceptive pills, preventing implantation using IUDs, killing the sperm using spermicide, and preventing the sperm from entering the seminal. First, oral contraceptives or pill is often referred to as the birth control pill, and it is type of birth control that is designed to be taken orally by women. So what is the advantage and disadvantage? This it does not interrupt sex. It usually makes your bleeds irregular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS. It can sometimes reduce your acne, and it may protect against pelvic inflammatory diseases. Here are the picture of. Next is the transdermal patch. So it adhere to the skin as a way of deliver drugs. They provide specific predetermined dose of medication that is absorbed through the skin and into the bloodstream. For transdermal patches offer a non-invasive and painless method of drug delivery, with the added benefit of providing a consistent therapeutic dosage over a predetermined time period. So what is the advantage and disadvantage of this? Okay, it reduces toxicity and local irritation due to multiple site for absorption and offers the option of avoiding systemic side effects. However, the transdermal route of delivery for many drugs is limited, since very few drugs can be delivered at a viable rate using this route. Example of this is in the picture. Next is vaginal ring. So vaginal ring is a prescription-only method of birth control. It's a small flexible plastic ring that you inserted in your vagina to prevent pregnancy. It's about 2 inches around. This method is also known by the brand new names called the Nova ring and the Anovera. So what is the advantage of this? Of using of this? The vaginal ring releases 15 mcg of ethinyl estradiol and 120 mcg of etonogestrel daily for 21 days. This is lower than the dose of estrogen released by the contraceptive pill or patch, resulting in fewer side effects due to estrogen. Well, the disadvantage of using of this is provides no protection against sexually transmitted infections, and it must be prescribed by a healthcare provider. Example of this is in the picture. Next is the some dermal implants. So it refers to body modification that placed underneath the skin, therefore allowing the body to heal over the implant, creating a wrist design. Such implants fall under the broad category of body modification. Next is hormonal injection. Injection steadily release the hormone progestogen into your bloodstream, which prevents the release of an egg each month. It also thickens the cervical mucus, which make it difficult for sperm to move through the cervix, and thin the lining of the womb, so a fertilized egg is less likely to implant itself. You usually have the Depo-Provera and Noristerat injection in your bottom, but you can have them in your upper arm. You can have also the Sayana Priest injection in your tummy, abdomen or thigh and would normally learn to do this yourself. So what is the advantage of this and disadvantage of this? Each injection lasts for either 8 or 13 weeks. It does not interrupt sex. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day, and it's safe to use while you're breastfeeding, and also it is not affected by the other medicines. So next is the intrauterine device or IUD. Is also known as is intrauterine contraceptive device, a small open tissue birth control device that is inserted into the uterus to prevent pregnancy. IUDs are the form of long-acting reversible birth control. One study found that female family planning providers choose large method for more often than the general public. So that's this advantage and disadvantage of this is protect against pregnancy for 5 to 10 years depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects such as acne, headaches, or breast tenderness. It does not interrupt sex. So here is the picture of IUD. Okay, next is the chemical barriers. So it is barriers against infection include enzymes in tears, saliva, and mucus that break down the surface of bacteria. The acid in sweat and in the stomach kills cellular pathogens, and there are antibacterial proteins in semen, the fluids that contain male sperm. So here is the example or the picture of chemical barriers. Male condoms and female condoms. Male condoms is a thin tube that fits over the penis. Penis condoms can be made of rubber, plastic, or lambskin. Female condom is also a thin plastic pouch that open on one end. Is the example. The blue one is for male and the red one is for female. Next is the diaphragm and cervical cap. Diaphragm is a rubber silicone dome with a firm, flexible rim. It fits the opening of the uterus called the cervix. A diaphragm is always used to spermicide. A woman puts in the diaphragm no more 6 hours before she has sex. After 1 year, 16 out of 100 women who has used diaphragm will get pregnant. Cervical cap. This is a rubber device and it is fit inside the vagina right up against the cervix and always used with a spermicide. The disadvantage and so here is the picture of cervical cap. Next is the surgical methods. It is a surgical procedure uh, international classification of disease mm, and referred to an passive therapy is performed in a patient surgery, which inpatient surgery is defined as surgical operation or procedure which formed in an overnight stay in the patient institution. The advantage of this and disadvantage is more than 99 effective of preventing pregnancy. Backing the fallopian tube and removal of the tube should be effected immediately, but use contraception until your next period. It will be not affect your sex drive or interfere with sex. What are the advantages of barrier method of birth control? Or condoms protect against pregnancy. They use the only method that may protect against STIs such as HIV, AIDS, and herpes. Barrier methods are safe to use while breastfeeding and do not use hormones. so they are safe for women who smoke or who have health problems such as heart disease or blood clots. This method does not affect the woman's menstrual cycle and cause less than hormonal type of birth. So the next is the disadvantage of the various methods of birth control. Method do not prevent pregnancy as well as IUDs or hormonal forms of birth control. It prevents pregnancy only if you use them every time you have sex. You may have interrupt sex to use some barrier method of birth control. A woman needs doctor prescription to get a diaphragm or cervical cap. Buying necessary is medical jelly to use the cervical cap is difficult. And so, so next is the way of using natural methods. So first, what is the natural methods? It is birth control do not involve medication or devices to prevent pregnancy, but rather rely on behavioral practices and making observation about woman's body and menstrual cycle. So one example of this is calendar-based method that various methods estimating woman's likelihood or fertility based on record of length of previous menstrual cycle. That is one example of natural method. Also, the basal body temperature. Basal natural family planning that requires only the purchase of a very accurate thermometer. So, here's the basal body temperature. Also, a technique used in family planning that temperature is the temperature of the body when you are completely at rest. Okay, that is the basal temperature method. So next of this is the cervical mucus method, natural family planning, also called a billing ovulation method. That cervical mucus method based on the observation of mucus pattern during your menstrual. So next is the continuation of cervical mucus method. To be clear, the using the cervical mucus method for the birth control requires motivation and diligence. If you don't want to conceive, you and your partner must avoid having sex or use barrier method of contraception during your fertile days each month. So next is the sympothermal methods. It is a birth control method in which women collect information on themselves of their menstrual cycle. That is the sympothermal contraception. So here are the advantage of using calendar method, include it being free, not having side effects, and allowing you to predict the days when you are most likely to fertile. The disadvantages include ineffectiveness when menstrual cycle shorter than 27 days and the fact that you cannot determine exact fertility dates. The cervical mucus method is good for determining when you are fertile by using your vaginal discharge as a way to determine where you are in your cycle. So the one disadvantage is that this method is not always easy to learn without the guidance of your OB or GYN or doctor. Next is the advantage of temperature method. It is like other farms, there are no side effects. However, you will need to keep careful track on your cycle to ensure correct dates. Many women forget to take their temperature at the same every day, usually right when they wake up, when can school and data and make it difficult to pinpoint when ovulation begins. The sympothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. So, however, these techniques share the same disadvantage that it's of this. So, next is the ovulation detection. So it triggered by surge of luteinizing hormone in the woman's blood, and occurs approximately 36 hours after the start of this LH surge. If the egg is fertilized and implanted in the endometrium, a pregnancy is established. If a pregnancy is not established, the endometrial lining that develops in reason for pregnancy is shed at the menstrual flow. So advantage of this is may be beneficial if you have slightly irregular period or find other methods of tracking your fertility difficult or unreliable or unreliable. Disadvantage of this is ovulation test kits can be expensive and there are no. And the last one is the coitus interruptus. Coitus interruptus is also known as withdrawal. It is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. That is the coitus. So the disadvantage of using this method is that of control for the man to pull out before ejaculation. The woman has no control over it at all. You may feel that it gets in the way of sexual pleasure, and even if DP because before sex, the man can still release fluid before the ejaculate. This pre-ejaculate does contain sperm. The advantage of this is they don't want to use other types of birth control for religious or philosophical reason. They need some kind of birth control right away and it's too late to use other methods. They don't have sex very often. It's free and convenient. It is doesn't involve any hormones or other chemicals, and it has no side effects of health risks, and you don't need you don't need to see a doctor or get a prescription.